Hi, my name is Charlotte Payne. I am videoing my health assessment. Um, Today is November 15th of 2018, and here is my driver's license. Okay, so hi, sir. I'm going to be your nurse today.
Hi,
Can you tell me your name?
RCM.
Mr. RCM, I'm Charlotte. It's nice to meet you. Um, Before we actually started this recording, we've already done some information. And that's going to include just a general survey of Mr. RCM, his vital signs, his measurements, and we're going to discuss that. First of all, Mr. RCM, do I have your permission to record you?
Yes, you do.
Okay, can you just look to the camera and
Yes.
do I have your permission to post it on YouTube?
Yes, you do.
And do I have your permission for my instructor to view it?
Yes.
Okay, thank you. Can you tell me what you do for a living?
I work at home for a Surian.
Okay, do you do a lot of sitting, a lot of standing?
A lot of sitting.
A lot of sitting, okay. So how old are you?
50.
50? Okay.
Yes.
So you appear to be your stated age. So your vital signs that we took earlier in your right arm were 108/70, and in your left arm it was 104/72. Are those pretty normal for you?
Yes.
Okay. Your temperature was 98.1. Your oxygen saturation was 98%. Your respirations are 18 to 20, which means you're breathing normal. Your radial pulse, which we checked earlier right here, was 74, normal with 2 plus. Okay, so first thing I'm going to do is I'm going to check your level of consciousness. Okay, so can you tell me your name?
RCM.
Okay, what's today's date?
November 15th, 2018.
Okay, where are you at right now?
My home.
Okay, and what are we doing here?
We're doing a physical assessment of my health.
Okay, perfect. So that proves that you are alert and oriented times 4. You know who you are, where you are, the situation, and the time. Just looking at you briefly, your skin appears to be normal for your ethnicity. It's pink. You've got really good turgor, so you look well hydrated. We discussed your appetite as well before we started filming, and you told me that you ate 2 adult-sized meals a day, sometimes snacked in between. Is that right?
Correct.
Okay.
Yes.
Also, in just scanning over you, I don't see any obvious deformities. You don't have any amputations on your toes, fingers, nothing like that, correct?
Correct.
Okay. With mobility and walking, do you require a cane, crutches, rollator? No. Okay. Mood and affect seem normal, happy, calm.
Yes.
And there's no problems with your speech and no problems articulating.
Correct.
No slurring, nothing like that. RCM, how tall are you?
6 feet.
Okay. And you said that you weigh about 220 pounds. Is that correct?
Yes, ma'am.
Okay. So that puts your BMI at 29.8. So by classification, that's overweight. It's not obese. It's not underweight. It's just overweight. Also, before we did this recording, we did use my skin fold calipers to check his body fat percentage. Our final number that we came up with was 28%. The way that we obtained this, we took behind the triceps and pinched. We took in the front and pinched. We took some here on his abdomen, and then again below his scapula in the back. We took all 4 numbers and we added them up. In this book, towards the back, there are some charts that give you, once you add up your numbers, it gives you the percentage. 28% is what we got for RCM. We then proceeded to check your vision, and you do have glasses. So the way that we did that was we used what's called a Snellen chart, and we put it 6 feet away from Mr. RCM, and with his glasses on, he has 20/20 vision. All right. So just a little bit of your surgical history. Have you ever had any surgeries?
Yes, I had a capsular shift on my left shoulder probably when I was about 22.
Okay. Any other surgeries? So you
No.
still have all your organs, tonsils,
Well,
adenoids.
I guess I got my tonsils taken out. I don't think I have them.
Okay. You still have your gallbladder, all those other organs. Okay, perfect. So for your dad, I'm showing he's got a history of prostate cancer. He's had a stroke, and he's also had a quadruple bypass.
Correct.
And your mom has had back issues and also myasthenia gravis.
Yes.
Okay. All right. So that concludes the very first part of our assessment, which is all the information that we gathered first. So we're just going to begin with your hands and nails. Basically what we're going to do here is I'm going to kind of work my way up, start with your head, come on down, and do your chest and back. Okay? So what I'm going to do before we even start is I'm going to go wash my hands, and then I'll come back, okay? Okay, so I've washed my hands. We're all good. So the first thing I'm going to do is just take your hands and just look. So we've got normal coloring. I don't see any dryness, roughness, nothing out of the ordinary. So you've got a tattoo here that looks a little irritated. How long ago did you get that?
About almost a year and a half ago.
Has it always looked like this?
Pretty much.
Okay, so it's not anything new. All right. Any tenderness up your arm?
No.
Okay. Let's check this one. I know we checked your radial before, but just to let them know it is normal at this time. No tenderness, nothing out of the ordinary, and I don't see any sores. All right, so we're going to just start with your head. You can, you can leave your glasses on. So you're just going to feel me kind of feeling around on your head, looking at your hair. I want you to tell me if any of this hurts though, okay?
Yes, okay.
If you have any tenderness. Does any of that hurt?
No.
Okay. And I'm just going to look through your hair just to make sure it's nice and healthy, not falling out. You don't have any bald spots coming back there. All right. Okay. So the next thing we're going to do is we're going to check your cranial nerve 7. Okay. And the way that we're going to do that is I want you to close your eyes. What this is checking for is to see your facial movements are symmetrical. Okay. So close your eyes, open them, raise your eyebrows, and then you can just kind of relax, puff out your cheeks. Okay, good. Very good. All of that was symmetrical. So your cranial nerve 7 is intact. Next, I'm going to check your temporal artery. And it should be equal on the same, on both sides. And for you, it is. And then your temporomandibular joint, which is right here. Okay, open your jaw, close it, open, close. Okay, so I don't feel any crackles, any strange movements, any clicking, or any out of the ordinary. It's nice and smooth. The last thing on your head I'm going to palpate is going to be your sinuses, okay? Do your frontal sinuses, any pressure there?
No.
And your maxillary, any pressure there?
No.
Okay, very good. We're going to move on to your eyes. I know that we've already done your basic eye exam. There's several tests that we're going to do, though, just to check your cranial nerve functions. The first one is called a confrontation field test, okay? And what we're going to do is we're going to cover our eyes. We're going to start with that eye for you. If you'll just hold that there. And I will hold mine on, it's actually the opposite eye, but it's the same one on this side. Okay. So I want you to tell me when you see my finger wiggle, okay?
I do.
Okay?
Yes. Yes.
Very good. Go ahead and switch to your other eye. Tell me when you see my hand come in to your peripheral.
Yes.
Okay.
Yes. Yes.
Okay, very good. What that checks is your peripheral vision, and you and I saw it at the same time, so that's good. So then the next thing we're going to check is your pupillary light reflex. And to do that, I'm just going to dim these big lights for just a minute. And we're still going to have this small light. All right, I want you to just kind of gaze straight ahead. And I'm going to shine a bright light into your eyes. And what I'm doing is I'm checking to make sure you have equal reaction in your pupils, okay?
Okay.
Here we go. Very good. Now, your right pupil is about a 6. Actually, it's more like a 7. Your left pupil is about a 5. So what that means, you have 2 different sized pupils. Have you always had 2 different sized pupils?
As far as I know.
Even when you were a kid? That's nothing new? Okay. That's called anisocoria. If you've never heard that before, just having 2 different sized pupils. Okay, so I want to check your extraocular muscles, which are your muscles around here. Very simple test. I want you to close your eyes tight, and I'm going to try to open them. Very good. Those are intact. The next test we're going to do is an accommodation test. Okay, I don't want you to move your head at all. I want you to just use your eyes. What I'm going to do is I'm going to bring the pin light in, and you're just going to follow that pin light, okay?
Okay.
All right, here we go. Very good. Okay. That just makes sure both of your eyes accommodate the same going in and crossing. So the next thing we're going to do is called the cardinal position of gaze. And what that is, it's going to kind of be the same thing. Okay. You're going to follow the pen light. We're going to start here. I don't want you to move your head at all. Just follow it with your eye. Very good. Very good. Very good. Okay, we're going to do the same thing on this side. Okay, very good. That just checks your eye movement. The next thing we're going to do is I'm going to check the actual inside of your eyes, and we're going to use an ophthalmoscope for that. The ophthalmoscope, you have red numbers and black numbers. Depending on if you want to see far away or close up is what's going to determine your numbers. So the first thing I want to look at is what's called a red reflex. And I'm going to shine this right into your eyes, and I should see some red. Yep. Lean forward just a little bit. Okay, very good. Next thing I'm going to do is I'm going to check the actual inside of your eye. All right? I'm going to dial this where I can look at your lens, your cornea. Your disc is nice and smooth. And your vessels, there's two main vessels that run through. So, all right, we're going to do the same thing with this eye. And your disc on this side is nice and smooth. Same with all the vessels. Okay? Are you blind now?
A little bit.
All right, I'm going to put your glasses over here so we don't squash them. So that pretty much covers your eyes, okay? Next thing we're going to look at is your ears. And I'm going to start by just inspecting them. We're just going to start looking on the outside. I don't see any redness, no drainage, no sores. Are either one of them tender when I pull on them?
No.
Very good. So this is an otoscope. And I'm going to use this to look into both of your ears. It's got a little, yeah, let's get a new one of those. All right. So I'm going to take the top of your ear, pull it up and back. And I can easily visualize your tympanic membrane in there. It's a nice gray pearly look. You pull up, pull back. All right. In your right ear, you have just a tiny little bit of wax in there, but otherwise it looks good. Tympanic membrane is easy to see there too. Okay, so we're just going to do some basic little tests, hearing tests. The first one, I'm going to whisper a couple of things, and I want you to tell me what you hear me whisper, okay? And for this, I'm just going to kind of step this way. I want you to cover that ear with your hand. There you go. Okay, you ready?
Yes.
Okay.
Cat, dog, kitten.
Very good. Okay.
Horse, mice, giraffe.
Yep. Very good. All right. So we're going to do a Weber test. And it's going to be, we're going to use this test here. Basically what I'm going to do is I'm going to create it to vibrate it and just hold it here on your head. I want you to tell me once it gets up there if you're feeling the vibration symmetrical or if you're not. Okay? Oh.
Yes.
Is it symmetrical both sides?
Yes.
Down. Okay. The next test we're going to do is called a Renee test. This one, we're going to do the same thing. I'm going to hold it to your bone back here. When you stop hearing it, just raise your hand. I'm
Okay.
then going to hold it in front of your ear. When you stop hearing it, raise your hand. Okay?
All right.
We're going to do both sides. Ready?
Yes.
Oops. Good. Okay, good. Do this other side. Ready?
Yes.
Okay. That bone right back there. Okay. Very good, very good. What we have found is once we put it in front of your ears, that is usually twice as long as what you hold it to your back. All right, very good. So moving on down your face, we're just going to take a look at your nose, okay?
Okay.
Just going to inspect it to begin with. I don't see any abnormalities. It does look a little bit crooked. Have you broken your nose before?
I think so.
You think so? Okay. Any tenderness? All right. I'm just going to shine my light up. Check it out. You ever been told that your septum is deviated?
Yes.
Okay. So we're just going to check your patency of your nostrils. All right. I want want you to just cover it. It doesn't matter which one you start with. Okay, and just do the other side. Definitely a difference. So you have a harder time breathing in this side, correct?
Correct.
Okay. And that is your right side. Okay. Have you had any drainage, sinus issues recently? Okay,
No.
perfect. So we're going to just keep on moving. Are you cold?
Yes.
Yep. Okay, hold on. I've got a little sheet that we can drape around you for now. There you go. Okay. So the next thing is your mouth and throat. Okay, so just looking, open up and just say, okay? Okay, you don't have to say, all right, now we're good with that. So just looking, I don't see any, lift your tongue up. Very good. Okay. I don't see anything obvious, no sores, no redness. Gums look nice and pink, not pale, not overly red. Stick your tongue out and say, ah. Good. Okay, what I did there is I just checked one of your cranial nerves to make sure your uvula moved. And that's actually going to be cranial nerve 9. Now, to check cranial nerve 10, we're just going to pretend, because I do not have a real tongue blade, but what we would do is I need to elicit a gag reflex. So what I would do is I'm not really going to gag you because I don't have the appropriate, is I would just stick this back, touch the back of your throat until you gagged, okay? And that's a good way to check your cranial nerve 10. Okay, so stick your tongue out, side to side, okay. So your cranial nerve 12 is intact. You're able to move your tongue around. We're going to move on down your neck. So I'm going to just lower your shirt. Just the beginning here. That should be okay. Okay, I see your scar from your surgery right there. Okay, so in just looking at your neck, I don't see any sores, no redness. Is there any tenderness anywhere in your neck?
No.
Not that you feel right off?
No.
Okay. We're going to check your lymph nodes, okay? First one's going to be your preauricle, which are here in front of your ears. Any tenderness?
No.
Postauricle? Anything?
No.
Okay, your occipital?
No.
Your parotid?
No.
No? Okay. Submandibular?
No.
Submental?
No.
Okay. We're going to come down your neck, and these are the superficial cervical.
No.
Okay, nothing there.
No.
We've got your supraclavicular nodes here.
No.
No tenderness. How about in front of that clavicle?
No.
Okay, very good. So we don't have any tenderness there. Okay, we're going to check your carotids here. I'm just going to feel for your pulse. We're only going to do one at a time because doing two probably make you pass out. Okay, carotid pulse is good and regular, 2+. Good and regular and 2+. The next thing I'm going to check for is any, what we call bruise in your carotids. It's any type of a swishing noise. It can be indicative of plaque buildup. It can be indicative of a lot of things. So we don't want to hear any, so I'm just going to test you, okay?
Okay.
All right. So what I'm going to do is I'm going to use the bell of my stethoscope. I want you to breathe out and hold it when I tell you to, all right? If at any point you need to breathe, go ahead and breathe. Because we're going to measure 3 different areas on both sides. Are you ready?
Yes.
Okay. You okay?
Yes.
All right. Good. I hear it beating away, but I don't hear any bruise. So you're good on that. Okay. Now we're going to check your cranial nerve 11. Can you move your head side to side? Up and down? Okay, can you shrug against some resistance? Good, very good. Okay. That pretty much wraps up your face, your eyes, your ears. I'm going to go behind you now and check your thyroid gland, okay?
All right.
Before I do that, just take a little swallow of water. I'm going to watch you swallow. Kind of hold your head back when you swallow. Very good. Okay, good. I'm just feeling your trachea here. It looked nice and midline when you swallowed, and I just want to make sure. Yep, easily movable and symmetrical. Okay. We're going to come back this way. I'm not choking you, I promise. Okay. I'm just checking your thyroid. All right, can you look a little bit to your left? A little bit more? There you go. Very good. Look a little bit to your right. A little more. There you go. Okay, very good. So while I'm back here, we're going to go ahead and start the back side of your exam, okay?
All right.
This is going to include listening to your lungs. Now, unfortunately, this is where we're going to have to take this down, but you probably could keep it up that way. Okay, so to begin with, I'm just going to watch you breathe, okay? Because what I want to make sure is everything moves symmetrically. So just breathe normal. And I don't see any abnormalities. You've got a couple of moles back here. Have you had those looked at?
No.
So those are on your left side. Okay. First thing I'm going to do is what's called a symmetric expansion. And it's where you kind of bring your hands together, bring up a little bit of the skin. And when you breathe, my thumbs should expand equally, and they do. Very good. Okay. Next thing is kind of a funny name. It's called tactile fremitus. What I'm going to do is you're going to feel me put my hand on you like this. We're going to go down this way, down this way. Each time I move my hand, I just want you to say 99. Okay?
Okay. 99.
Good.
99. 99. 99. 99. 99. 99. 99.
Very good. All right. Go ahead and lean your head forward a little bit. This little notch that sticks out here is what we call your spinous process. It's part of your vertebrae. Okay. Next thing I'm going to do is what we call percussing your lung fields. You're going to feel me tap on my hands. It's going to be kind of a strange sensation, but what I'm looking for is a change in the sound that I get, okay? The first time that we do it, I'm going to have you exhale and hold, kind of like you've already done, okay? Tell me when you're ready.
Ready.
And breathe normal. Okay. You okay?
Yes.
You ready to keep going?
Yep.
All right. So we're going to go on the other side, and I want you to do just the opposite. I want you to inhale and hold, okay? Okay. Let me grab my ruler real quick. Let's see what you got centimeters on this thing. All right. All right, so you're right at 5 centimeters, which is normal. All right, I'm now just going to do a quick test on your kidneys. What I do is I come down here to your costovertebral angle, which is right in here. I want you to tell me if you have any pain, okay?
Yes. No.
Okay. Any pain?
No.
Okay, good. All right, so on your lungs, the last thing we're going to do posteriorly is I'm just going to take a listen to you breathe, okay?
All right.
I want you to take a little bit deeper than normal breaths. If you start getting lightheaded or anything, just breathe normal.
Okay.
Because I don't want you to get lightheaded. All right?
All right.
Okay. Very good. I'm going to take this arm, and if you'll just raise it up, you don't have to straighten it or anything. Deep breath. Okay, you can put that down. We're going to do the same thing on this side. Good. Okay, very good. Your breath sounds are nice and clear. I don't hear anything adventitious. There's no wheezes, there's no rills, there's no rhonchi, no crackles. All very normal. Okay, so we're gonna kind of do the same stuff front ways. Okay. I'm just going to inspect to begin with. So just breathe normal. I just want to make sure everything moves symmetrically. And it does. So the same thing that I did in the back, your symmetric chest expansion. I'm going to put my hands here. Just breathe normal. I'm going to push up a little bit of skin. And my hands expand symmetrically with each breath that you're taking. All right, that funny one called tactile phragmatus again. Each time I just want you to say 99.
99. 99. 99. 99. 99. 99. 99. 99. 99.
Very good. Are you having any tenderness? No tenderness at all anywhere in here?
No.
Good. Very good. All right. So we're going to kind of do the same thing with the percussion. We're going to do, right, start up in here. Okay. All right. Oh, go ahead and exhale. You okay?
Yeah.
Exhale and hold. You holding? See if you can breathe. Inhale. Inhale and hold whenever you're ready. So up front, you're about 3 centimeters. Okay, same thing. I'm just going to listen to you breathe. A little bit deeper than normal,
Right.
but not to where you get lightheaded, okay? Here we go. Okay, very good. Again, no adventitious lung sounds. Everything sounds very clear. Nothing's diminished. We're going to check your upper extremities next. I'm kind of cover you up a little bit. Go ahead and hold your arms out. Move your hands around. This is just checking your range of motion, up and down, out, side to side. Okay, so let's take this arm right here. Just relax it. Let me have it. And I'm just checking brachial. Okay. Now we're going to do just a quick little test to see if I can feel your nodes in your arm. Your epitrochlear nerves. Nodes. Okay. I'm going to check over on this side. Just kind of shake my hand. And you usually can't feel them, so if I were to feel them, there would probably be an issue. Okay. Take both of my fingers, squeeze, 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 squeeze. Okay, and that's very lateral. Put your hands up to mine. Push, push, push. Okay, symmetrical, very good. All right, RCM, we're getting to the end of this physical exam. I want you to go ahead and lay down. I'm going to check your neck muscles and your heart, and then we're going to be done, okay? Perfect, perfect, perfect. Okay, so take my pen and paper over on this side so I can take some notes. So the first thing I'm going to do is check what's called, need a note card here as well, your jugular venous pressure, okay? What I'm looking for is your pulsation over here. You can see it here. I'm going to put a little ruler here in your sternal notch. And right where that pulsation is. Yeah, okay, that's 40 down. Perfect. There it is. And you're at about 2.5, which they say to round, so you're at 3. The next thing we're going to do is check your heart. I'm going to check and just inspect first of all and look. And I don't see anything out of the ordinary. No heaves, no pulls, nothing like that. Do me a favor and exhale and hold. Okay? You had that cough long?
Little.
What I'm doing is just feeling for your impulse. Okay. You can breathe. Okay. Exhale and hold. Yep. All right. Very good. Let's see. Now I'm just going to listen to your heart. Okay? 4 different points. I'm going to start with your second intercostal space. This is your aortic valve. Move over, directly over. Come down to Erb's point. Down one more. And then mid-clavicular right here. Very good. I'm going to flip to the bell of my stethoscope and do the same thing. This is checking for murmurs. We're going over the same nodes here. All right, last thing I'm going to do is listen to your apical pulse for 1 full minute. Okay, so for the benefit of time, I listened for 30 seconds. Your rate is regular. So you would be 84 for the numbers that I got. Okay. Mr. RCM, we're done here for today. I appreciate you assisting me in the physical assessment
Thank you.
and allowing me to video record you and all that good stuff. All right, thank you.
Thank you.